Right. That's more interesting, isn't it? Right. Apologies to those who are attending virtually. I'm not going to go back over the entire thing, but it was because my mic wasn't working. But that does sound like someone's got volume on, which is being worked out. Hello, Tracy. Tracy has arrived. Welcome, Tracy. Right, so I'm not going to read out that entire list of things. It'll take another 10 minutes, so we won't bother with that. But just be assured, I have welcomed everyone to the meeting and given some ground rules. So, Gordon, apologies for absence.
Yes, we've had apologies from Superintendent Zahid Aziz and from Emily Evans from Thames Valley Police, from Paul Coe and Maria Shepherd is substituting for him, from Dr. Janet Lippett and William Moore from Royal Berkshire Foundation Trust, and from Gary Paulson from the Volunteer Centre, and Rachel Peters is substituting for him.
And of course, as I said before, although you won't have heard me if you were watching this on Zoom, from Thames Valley Police, we have Inspector Al Hawkett. Welcome, Al. And what I would just say to everybody is that just shows that think about who your subs are. Make your subs as wide as possible. I've suggested to Al that, for example, for Thames Valley Police, it might be any officer above the rank of the rank of inspector or above is a substitute for the superintendent, who is a formal member of the board. That way, we're covered if you need to come in, and you get a vote, which is more to the point. Okay, moving on. Minutes of the previous meeting. I have the minutes in your pack. And by the way, let's just be aware, this is a massive pack today. So let's try to keep to time. Let's try to move things forward. Otherwise, we'll be here all night. You have the minutes of the meeting on the draft minutes of the meeting of the 8th of December. Has anyone got any amendments they wish to suggest to those minutes? Not seeing any hands, not seeing anyone hands in the room. So I will formally propose that we adopt them. Does that find a seconder? Thank you, Councillor Stewart. And those in favour in the room, I'm not going to go to a virtual vote. All those in favour? Anyone against? Any abstentions? Thank you. Signed in advance. There you go. Right. Next item is actions arising from the previous minutes. So can I ask, Gordon, is there anything you want to particularly highlight on these actions arising, or are we just taking them as read?
I think it's just taking them as read. There's been no further updates, Chairman. And
so I'll now go to questions on those. Councillor Vickers, Mike.
Right. Thank you, Chair. Just 213, where it said there would be further information from Bob after the half-term break about the response to the Healthwatch CAMS report. Is that this meeting or the next meeting, or?
Well, clearly, half-term has only just ended. So I'm happy to look to Sarah, perhaps, for a comment.
That can come to the next meeting.
Thank you. Anything else on the matters arising? No, no one putting their hand up. So I think we'll take that as read. Moving on. Declarations of interest. Gordon, I want to add a formal declaration to be added to the list of my declarations that comes at every time, which is now being a member of the ICP. Councillor Vickers, microphone, Councillor Vickers.
And I'd just like to remind those present that I am a member of the Healthwatch Board.
Thank you. And thank you. Steve.
Thank you, Chairman. I was involved in the interviews that are included in the asylum report from Healthwatch. So
noted.
Although I'm not named.
And I was also involved in those.
Thank you very much, Dr. Verdon.
My practice falls under the remit of the refugee hotel.
Thank you. Any more for any more? Right. Thank you. Okay. We now move on to public questions, and I think we've had a question from Paula Saunderson, who I hope is in the virtual room. having a quick look. Have we invited her in? Is she there? Okay, so that question will receive a written response. Moving on to item 6 on the agenda, which is petitions. Gordon, have we had any petitions?
No petitions received, Chairman.
Thank you. We now move on to membership. So there are some changes to the membership. Obviously, as we always say, the membership of the board is really operational. So it's an organisation that puts forward someone, but we do obviously need named individuals in order to make the voting process correct. So the changes since the last meeting include that Paul Coe has become the interim executive director of people in place of Andy Sharp, and Maria Shepherd is here as substitute. Fiona Warby has replaced Andrew Sharp as interim Health Watch West Berkshire lead officer. And also in anticipation, we'll come to Steve in a moment, Steve Welch is leaving West Berkshire Council, and therefore April Pebbody has been appointed as the interim service director. Now that appointment is imminent, but not today. So therefore, from the next meeting onwards, April will be a formal member of the board. I think those are the changes, and therefore now to reflect that this is the last meeting for both Steve Welch and Professor Tracy Daskovitz, and I want to thank them both for their contributions to the Health and Wellbeing Board specifically, and to the general work of the Health and Wellbeing Board and to public health, in particular in Tracy's case, within West Berkshire and indeed within Berkshire West. So thank you both. We wish you well in your new endeavours. Members, I'm now going to change it because Carolyn needs to get away. I'm going to change the order of the agenda and bring item 12, which is the Health Watch report on asylum seekers, up the tree so that we deal with it now. If you turn to that report, as you can see, it's a fairly involved report, and I would remind everyone, and we'll come back to this concept in a little while, that this report we considered wasn't quite ready in the form it was in for the December meeting. Therefore, it's been taken away. There's been work done on it, and I thank Health Watch for engaging in that work, in engaging with officers, and we'll come to those officers in a moment. And I'm just going to check who we've got to speak to this. Sarah Deason, thank you for coming on screen. So I'm going to hand over to you to introduce the report, and then we'll go to questions and contributions from the floor.
Okay, thank you. Yes, so the report's in the pack, which you would have seen, with an overview. Last year we spoke with the help of various partners to a number of asylum seekers living in the accommodations in the places in West Berkshire. We spoke to a number of voluntary organisations who helped us with the report, and the upshot of it was what we saw was that there were various concerns relating to the difficulty of accessing information about healthcare services, barriers to attending appointments and preventative care, the quality and nutritional value of the food, particularly around people with who need particular diets, and also boredom and desperation, because have been a lot of them have been there for a long time. They don't know what their situation is. We heard about people being moved, within hours' notice, and so they can't work. They're in, some of them are very isolated. So the boredom and lack of engagement is really setting in. So the impact on their mental health from that as well. So following that, we made a number of recommendations which are around those issues. So we asked the ICB and West Berkshire and the police and Berkshire Healthcare Foundation. They've all responded to the report, as you've seen. So what we're hoping to do now is move forward, and with the understanding that obviously some of the local issues are impacted by the Home Office and national policy, there are some things that we believe that can be done locally to try and relieve some of the difficulties for these people living in West Berkshire.
Thank you. I think I'll start from the chair, if I may, which, because obviously this is an important report. It has made the front page of the Newbury Weekly News today. And I want to start by commenting that, as I think we said last time round, clearly the main player in all of this is the Home Office, not this council. And I'm going to turn, I know that officers have very recently made visits, and therefore I'm going to look for the current position from officers. I think, Al, you also had an opportunity to take a look, see, as I understand. So I'll look for contributions from Carolyn and Sean in particular, and then anyone else. Let's start with Carolyn and Sean. Carolyn.
Thank you, Chair. We actually went there yesterday as part of a sort of routine visits that we do periodically, and not least because I'm actually doing a handover at the moment. So it was important for the new person to actually understand the hotels and the regimes. I must admit, when we were there, and I've been there several times, it's certainly there are two different hotels, different types, different styles, and they are quite different in possibly the environments that the guests are living in. But certainly where we were there, everything was running really well. There was lots of fresh food that we could see. But Sean's team in particular are in there from an environmental health point of view, and certainly from a food hygiene point of view. And what we could see, there was certainly plenty fresh food, and it was the choices that they were given. They were asked regularly about what choice of food they would like, and it's a rotation every 3 weeks. They have different suppliers, which I think is probably quite relevant to this report, because some of the pictures of the food do look pretty awful. It's not what we saw yesterday anyway, and the rotation of the food, as well as dietary needs and things like that, appear to be getting accommodated. I can't obviously speak for absolutely everyone, but and every time, but it certainly looked as if it had been well prepared and well resourced at that time. The guests that are there appear to be relatively well settled, those that have been here for quite a while, and some of them have been here quite a while, but there's also quite a reasonable turnover as people are moved on to through the asylum process, either to they can actually stay with guests, can stay with friends and family if they've got some in the UK. So there is quite a bit of churn, if you like, happens, which I think would be quite an impact on the health service because of that. But certainly our view yesterday was that they're quite settled, they're integrated, they're well respected within the community, and indeed Newbury Weekly News I think recently reported on some of them are going out doing litter picking through the towns and things like that. So they're involved with quite a lot of local charities. They are learning English. So and as I understand it, they respect and appreciate the welcome that they've actually had in West Berkshire generally. So nothing really significant to report.
Before I come to Sean, given this is a public meeting and there may be people who aren't aware, can you clarify the role of this council in relation to these hotels? What your role is within the council in relation to that? So, and then Sean, when you come to speak, I'll ask you to pick the same questions up, so that we understand where we sit and where you sit in the process.
My role in it has been a legacy thing to some extent, because I was involved with the Afghans when they arrived, and indeed the Ukrainians as well. So I've been involved with the migration piece, if you like, quite a bit over the last few years. And like a lot of things, indeed like the Afghans, we were given less than 24 hours notice that those hotels were coming into the area from the Home Office. So clearly they are Home Office hotels. Our responsibilities in it are our statutory duties. So the safeguarding side of things, the education for those that are where we have children, and there are not many children in it. In fact, one of the hotels has no children in it. It's only one hotel, and we support them, making sure that they can go to the local school where they're well integrated there. So statutory duties, safeguarding, education, environmental health and safety in the hotels. Other than that, we have got a core group within the council of statutory providers, which includes health services and public health. Well, I was going to say Public Health England, UKHSA, and TVP are involved in that. So there's an opportunity for us to engage about any issues, speak specifically about any cases or clients of concern or anything like that we may have, and we coordinate our response accordingly if it's necessary. Again, very little issues have been raised during the period that we've been involved. I think that's probably enough. I'll hand over to Sean unless you've got any questions, of course.
No, thank you. What I will do is I will come back to you for comment on the recommendations of the report, because one of the things we're asked, this board is asked to note the report, endorse the recommendations, and ask key partners to act upon those recommendations and do updates. So I will ask you in a moment to comment on the recommendations, because there are 12 of them, and we may have a different view on different bits of recommendation. But now to Sean. Yet another microphone issue. We'll just swap that out with another one that works.
Is that working, Chair? Thank you. Yeah, so just picking up on the point about the statutory role of the authority, as you have pointed out, as Carolyn's pointed out, I mean the actual operation and delivery is down to the Home Office and their contracted suppliers. But from my service point of view, we do have a responsibility, a statutory responsibility with relation to things like health and safety and food safety at the hotel. We have carried out visits there. As part of those visits, as well as doing health and safety inspections, we also carry out, for example, reviews of incident logs and have a look at basically how any incidents have been handled on site. So that's the statutory responsibility that falls within my area. Carolyn has very well described some of the other responsibilities of the authority. Just going back to the recent visit, certainly my view was that there was certainly a very good stock of fresh food, fresh fruit, certainly in the premise, and also toiletries as well now. So obviously the report describes the situation at that time, but at the time of the visit, there was carried out yesterday. There was clearly a very good stock of things like that. We discussed some of the procedures, safety procedures, issues around community cohesion, and I think a lot of work has been done, and some of that has been reported in the local news about some of the work that's done in terms of volunteering and community work, and also the differing responsibilities between effectively the company, the Home Office, and also basically the hotel owners as well. So that's really kind of my update, Chair.
Thank you, Sean. So Al, did you want to add anything from you, because you've been there very recently as well? Whether you have anything to say on that?
Thank you. I haven't been recently, but I've been having a look over the Facebook posts that have been posted this morning on the Newbury Weekly News website in relation to the article. And I think it would be fair to say, as it currently stands, there is a kind of a low-level kind of hostility towards the fact that people are raising issues around food or accommodation, when perhaps maybe there are people in the community that are finding themselves in similar difficult situations. But as it currently stands, I will monitor that Facebook feed, but I don't believe that it's anything more than other people expressing an opinion. I don't think we're verging on any criminal offences as it currently stands at the moment, but I'll monitor that as we move forward and take whatever action necessary to prevent that from escalating.
Thank you. Before I go to contributions from the floor, I'm going to go back now to Karen and Sean, because I do think we need to understand that there isn't a report here from the council in relation to the Health Watch report. Now, as I say, it is entirely up to Healthwatch to make their views known. That is their prerogative, but we are being asked as a board to do certain things in response to that report and on recommendations of that report. So I do want to have the council's view of some of those recommendations. Sorry to put you on the spot, Carolyn, but there you go.
No problem. So the proposals, I'll just go down the list. The first one is providing more useful information about how the UK health and other services work. Within the hotel, when they get inducted into the hotel, they actually get a booklet, they get an induction, and there's lots of things on the wall. They'll make the place look horrible, I will admit, but actually it gives the people that are maybe a bit shy about things to actually look at things on the wall in their own time, to look into what facilities and options and things like that are available. That particular recommendation is more home office, and I'd probably look maybe more to the health colleagues to respond on that one in particular. If I just go down, I'll just go down the list just now. Manage migration systematically. I think there's a couple of things here. As you heard me say, we have got a core group of officers, statutory responders, who get together to consider our statutory duty. We do actually talk about cases and sensitive information. So we have to be mindful about who would be part of that group going forward. Positively, we have actually just recently appointed an officer to oversee the migration as a whole. As you heard me say earlier, there's quite a few migration work that we're doing just now from Afghans, Syrians. We still have. They've got the Hong Kong British nationals as well as Ukrainians. So we've just recently appointed somebody, and that's one of the things that I think that person would be looking into to see if we what other strategy and operation that we might be putting in place. So I think it's something we could look at, but we'd have to be mindful about the sensitivities of some of the conversations that we have as to who would all be involved in that. And that may well, it could include DLUC or Home Office, because there are different parts of the government that run the different migration side of things. So I think that's something that we could look into, because that's something we're looking into already within the council. Improve the food and the nutrition. That's a Home Office responsibility. I'm not the medical person to actually say whether the nutrition of the food is good or bad. I can tell you that it looked good when we saw, but I'm not that medical person, and I do know that they had diabetic stuff and foods and various other things. So when they find out about somebody having an allergy or whatever, they accommodate it, but I'm not the expert to say whether it was nutritionally sound or not. So I think that's a Home Office responsibility. Providing community outreach similar to the homeless outreach team. I'm not fully aware of the homeless outreach team, but I think that's the HOLT that we're referring to there. I think it would be the health, again, we need to have a look and consider that rather than us. But again, and sadly, none of them have recourse to public funds. So depending on if there's any financial bit associated with it, would be whether we could actually do something with it. The monitoring the women's health and safety. I believe that's more a Home Office and health side of things. From a safety point of view, certainly police and environmental health are involved in that, from if there's any inappropriate, not just women, but males as well, or children, any inappropriate safety issues, and then that would be the tradition, the normal route would be used for that. But I'm not sure if it's actually altogether the council. It's wider than the council. So this group may wish to consider that. Provision of activities. Certainly yesterday when we were there, I think, and it is different in different hotels, but there is certainly a lot of stuff that's been going on, and the community have been getting engaged with. And that's one of the things I think is a bit of an ongoing engagement process. If there's something that comes about, then they link in to ask, and then we can hopefully support in some way to facilitate them. But at the moment, there's no ask that's come to us. Assistance of the families to ensure children can continue in the schools. That's not our gift to actually deal with. We haven't had any, I think one of the reports, we haven't had any children taken away from the schools as such. We've had quite a steady family in one location now, and they are well integrated into the community. So I'm not sure if there's anything that we could actually do because we're linked, it's the asylum process, and if the Home Office decides to move them, then unfortunately that's what the process is. A regular residence independent. Stop. Sorry, I didn't go mute there, so everybody got that there. A regular independent wellbeing survey. I do know that the hotel, as part of their processes, they do actually do checks on certainly from the food side of things and menu checks and the like. I understand certainly the discussions that we've had with them about the wellbeing side of things. They do talk to the residents that are there. I'm not saying it's not a good idea to do, but who would do it, and then what would what would happen? A lot of it, the wellbeing side of things, I would guess, I'm guessing here, that are probably coming through the GP surgery side of things, and then the effects of national policies and issues. I think that's not really in our gift to actually to do too much about, I'm afraid. We monitor it and see what's happening, but I don't think it's in our gift to actually do too much about. Hopefully that helps.
No, it does indeed. So just checking officers don't want to add any more before I go to the floor. Sean.
Chair, can I just add, I don't really, I won't go over what Caroline's already gone over, but just to say, in terms of these recommendations, obviously a number of these things are in the gift of the Home Office. However, there are bits, there are certainly parts of the council's statutory functions that contribute to some of these things, and same with statutory partners. And obviously we will take any of these recommendations away and have a look at them in the context of our statutory functions.
Thank you. Sarah, obviously I'm going to come back to you.
Could I just make a comment that the response we did ask the council for a response, and it is in the report. There is a written response within the report. Just wanted to make that clear.
Indeed, I agree that it's simply that, of course, you are asking us to adopt certain recommendations, and I think we need to draw those out a little before we come.
No, absolutely. I just wanted to make it clear for the record that we had included a response from the council and also the NHS, police and Berkshire Healthcare in the report.
Indeed, thank you. Right, I'll now go to the floor. Councillor Masters.
Thank you, Chairman. As I mentioned, I was with the interviewees, which was quite a humbling experience on many levels. What was clear to me in the chaotic few weeks at the beginning of this the asylum process, when the hotels were commandeered, was the lack of communication from the Home Office. All the agencies that were assisting, from the police down, they felt that there wasn't a decent amount of communication. It was kind of imposed on the area, and that lack of communication brought out not only the very best of the community, but also at times the very worst. And clearly, with the charities getting involved and Health Watch putting together this survey and this report, it's sharpened the focus on the providers, the private companies that provide the hotels and the services and the food and everything. And I think there is a strong case, as Caroline and Sean have said, that things have improved on the ground. It was pretty horrendous, in those hotels at the beginning, and the experiences that are related reflect that. I have two questions. One of them to the inspector. You talked about the low-level, opinions that are on. I've seen those. It was particularly vile in those opening weeks, on social media. And in light of the response across the country by some of them more unpleasant far-right groups organising around hotels, particularly Knowsley and similar areas in the north of England, do you have the resources locally to monitor what's going on and have an adequate plan and response should we find ourselves in a similar position.
Certainly, from a force perspective, it's monitored in conjunction with other neighbouring police forces. All of the hotels in West Berkshire have an allocated point of contact at either a PC or PCSO level that go in and routinely engage with the hotel, the staff and the residents on a regular basis, forming those grassroots connections with them. There is a wider force-wide plan in place that can allow us to respond to instant protests and demonstrations and such like. So we have that in place anyway, whether that's a Stop Oil protest or barricading the motorway or Extinction Rebellion or whatever it might be. So those plans are already there and we would adapt and deploy resources accordingly. Thankfully, we haven't seen much of a footprint here in West Berkshire in relation to any protest activity at the hotels, or if there has been in the early days, when you mentioned when they were first set up, it was a very low level presence from the protesters and no criminal offences were committed at those times. So it's constantly being monitored. We have the capability to respond to it. And we've got those connections with the hotels as well, just to ensure that intelligence and information is being shared, not only between the community, the residents, the hotel, the police, but also the wider council as well.
Thank you very much. And my final question, Chairman, is in terms of resource, has the Home Office provided additional funding to the council to support its statutory duties that Sean and Carolyn have explained?
Well, there are a number of us who could respond to that one, but I'll let Carolyn.
We did actually get a one-off right at the beginning contribution to it. And I would say it's probably just about enough to cover what we've actually been doing. So we did get a one-off at that stage. I don't know whether we're going to get, that was a tail end of last year, whether we get any more.
Has that money been spent, or is it?
It's mainly because of resources. Resources going out, extra work and staff having to do.
Okay.
Very similar to the Afghans and Ukrainian type funding contribution.
Thank you, Chair.
Councillor Vickers.
Thank you, Chair. I think we've all obviously found this report useful, and obviously Health Watch, although I've declared I'm a member of the board, is doing its role in bringing this matter to us for proper discussion. And I think I'd like to sort of thank the council for its detailed response. I think it's a really thoughtful response, and both the council and NHS have put some thought into it. Obviously, there are limited responsibilities from the council, but I think the council is really an advocate for these people, as it is for other members of the community, when there are issues that possibly need to be addressed at a higher level. We can keep reminding the Home Office of the situation of these people. I visited a group of women. I only went on one visit to one of the hotels, and really it was very, well, as Steve said, it's distressing to know what these people have been through to actually get here, and then to be here and find that they're sitting in a sort of limbo. They might be relatively safe, but they are, what happens to me next? And the women I met, some were extremely skilled, and they were there with wanting to be part of the community, wanting to contribute, and with a lot to contribute and being left in limbo. I know that's not what anything the council can do. The involvement and the volunteering and making people feel that, that we appreciate what they're going through, I think is important. I've noted there's been some move towards volunteering with groups of men. I'm not quite sure whether it's so easy to involve women in the same way. They're probably more as sort of individual volunteers using their skills. And I hope there's something going on about that they can be made to feel welcome and be involved as individuals. I think hopefully we will not have the troubles that have been seen in other parts of the country. So far, the community response has been a really positive and quite commendable one. We've got some excellent volunteering groups that have done a tremendous amount to befriend and work with the people, particularly the women. And I think hopefully that's what we're going to see locally. I'm sure most people are actually sort of go along with that. And although a lot of people are going through hardships themselves, I think it's not on the same level as what these people have been through. So thank you to all the volunteers, and thank you to the council for its response.
And thank you. Dr. Feldman.
Thank you, Chair, and thank you, Board, for the opportunity to speak to this. So I declared up front my practice is one of the practices involved in the care of our local refugees. And I think what should be said is what Caroline said right at the beginning. How quickly this came about right at the beginning was phenomenal. And I don't think all of us were quite prepared for the situation that was at hand. And what made it more complex, it's not a group of refugees from a singular country. It is from a whole host of countries, which means a whole host of languages. And the language barrier was a very important thing of note at the beginning. And I must hasten to say that the situation has certainly improved a lot from how it was right at the beginning. And that was in the throes of some of the tail ends of the pandemic. It was just a perfect storm, and the pressures that primary care were also under. I welcome quite a few of these recommendations from Health Watch. Certainly the very first thing that is mentioned there, access to health. And although there's a nice picture of everything and a lot of posters, in your traumatized state where everything is completely different, reading how access should be had is not the most user-friendly and helpful. Then how health, 111999, it's all different. And a lot of that access is now through telephone. And then immediately we are posed with a language matter again. So I do think there's still a lot of work and hopeful opportunity to work with health, with primary care, in how we help educational groups, allowing for questions and so forth, not simply a poster or a welcome leaflet. With regards to, there's lots of things, and I'll try and keep it brief. The nutrition, I think even nutrition has improved, but yet again, right at the beginning, it is different nationalities, so what you expect in your dietary is a whirlwind of difference. I do think it has improved a lot, and that is a good thing. From a women's health perspective, there's a big cultural difference as well, and I think that should also be taken into note. I think one of the women in the report mentions, living next to a whole lot of people and you're a single person or such like. The main age group of the refugees in our area is between 18 and 40, so young men. The other big thing that was mentioned in there was boredom, or it is going from a flight or fright situation to sitting still. So we welcome all the voluntary people that stepped up and stepped in, and that has made a difference. Seeing the difference of a game of football or cricket in that human interaction that does not require language goes a long way. So I really thank everybody involved thus far for the efforts. And probably need to ask for your help going forward as well for us to continue doing that good work. Thank you.
And now I turn to Sarah Webster before I come back to Sarah Decent. Sarah.
Thank you very much, Chairman. So I work for the NHS Integrated Care Board, and our full response is in the report, so I won't repeat that. Just to add that we are planning a series of ongoing assurance visits to the hotels across the Berkshire West Patch, which includes West Berkshire. And we'll be coordinating that with partners, but actually it's not a bad thing if we have lots of ongoing visits through different routes, because I think that the more the better in this situation. But I would echo comments from the room that things do seem to have improved since this report was raised, and thank you very much to colleagues at Health Watch for helping to shine a light on that. Chairman, in response to your question and prompt around, do we as a board accept the recommendations and therefore commit to deliver against all of them? I think there's an important distinction to make between acknowledging the issues and wanting to address those issues, and being able to commit to some of the specific recommendations in the report that have been designed as a suggestion on how we might address those going forwards, which we will of course consider and make sure we take into account, but we need to make sure that they are all feasible to do. For example, recommendation of a mobile community-based service to manage the primary care needs of the residents. That is one option that we could look into to address the issues that have been identified in the report. There are many others as well. So we're considering this as Dr. Veltman just mentioned, and looking at the best way to address it in a way that's feasible. So I think we need to bear that in mind as a board. We are acknowledging and committing to the work to address the issues identified. Thank you.
And thank you. And before I come to Sarah, the agenda item is to present the report. That is the agenda item. And I think the report has been admirably presented. I guess what I would propose we come to, and I'm saying this now so Sarah has an opportunity to respond if she wants to, is that we clearly note the report and we take on board the recommendations, and we leave officers and organisations noting the report to themselves take on board whether or not they are practical, can be achieved, and have matrices around them so that we know whether they're happening. And I will look to officers from West Berkshire Council to, so far as the council is concerned, to respond as to whether or not there are things in here that the council can be doing, which it's not already doing. And a lot of stuff is already being done. So, Sarah, I'll now come to you to wrap your position up and in the light of what I've just said.
Thank you. Yeah, and thank you, Chair, and thank you all for your consideration of the report. And to say that we look forward to working with you on the recommendations. Very happy to have the further conversations, and as we've said, we will be following up. Obviously, we want ongoing conversations and things in our role as Health Watch, but we will be doing a formal follow-up in 3 months to look at what the situation is and what's been happening. Thank you.
Thank you. So what I will do is normally, if we were simply noting a report, we wouldn't need a vote, but I do think that given the stance I've just suggested, I would like to take a vote on this. So my proposal is that we note the report and we encourage those organisations which have a role to play in respect of the recommendations to consider those recommendations and respond as necessary through to Health Watch, including West Berkshire Council. So firstly, a virtual vote. Those on Zoom, you've got Zoom hands, if you could put them up. Those in the room, I'll take a show of hands. Thank you. My erstwhile leader has pointed out I need a seconder. Can I look for a seconder for that? Oh, look, the leader's seconded. Well done, everybody. Thank you for keeping me on the straight and narrow. So those virtually put your virtual hand up. Those in the room, virtual vote. Yeah, everyone has seen what that was. Right, now, those in the room, formal vote, yay or nay. So those in favour? Anyone against? Any abstentions? Unanimous. Thank you. Thank you all. Let's move on. And again, thank you to Health Watch. Right, we now move on. We come back to the agenda and item 8, which is the Bob ICS update. Now, for those of you, and I think that there are 2 of these items, those of you in the Health and Wellbeing Board conference will have had a flavour of this already. So in that light, Sarah, and knowing that we're under, we've got this massive agenda to get through, I turn to you.
Thank you very much, Chairman, and I take the subtle hint to keep this as brief as possible. So just as I put in the slides, a quick reminder on what is Bob. So it's a health construct around and bringing together three areas that we call places, covering the geographies of Buckinghamshire, Oxfordshire and Berkshire West, which encompasses West Berkshire, Reading and Wokingham local authority areas. When we talk about an integrated care system, that's talking about that kind of broad geography and within it. When we talk about the integrated care partnership, that's the formal partnership board that spans that geography, of which our good chairman is a member on the board. And when I talk about the integrated care board, that is the NHS statutory function within this system. Still with me? So my update is going to be covering some of the key things at the moment. So an update on our integrated care partnership strategy, a note around the integrated care board joint forward plan, and then a quick update on Berkshire West and our kind of local development here. So briefly, the Integrated Care Partnership Strategy, which we have considered in this board previously, went out to public consultation, which closed in January. We are now working through the feedback as a partnership, and the final strategy, or proposed final strategy, will be going to the Integrated Care Partnership Board on the 1st of March and will then be published. So we'll be able to share that far and wide, and that is our Integrated Care Partnership commitment. As you'll be familiar with, it's built up from our local health and wellbeing strategies. So this is not to add an extra, a different layer. It's a kind of combination of priorities across the partnership, with a particular focus on things that we think can only be done or can be done better by doing them together as a partnership across the broader patch. In addition, as an integrated care board, an NHS integrated care board, we have a legal responsibility to prepare a joint forward plan, which is the joint NHS forward plan, a 5-year plan of what we're going to do and what we're going to focus on over the next 5 years. Clearly, this links to delivery against our strategies, both the integrated care partnership strategy and our local joint health and wellbeing strategy, and how we as a health partner will be delivering against that. So we're working on that at the moment, and there is a requirement for us as a health and wellbeing board to consider and comment on that plan, which we will be discussing with everybody and through the officer route initially, to make sure it's a well engaged plan as it develops. So the proposal is that comes back to this board in April, and I'll liaise with Gordon on that in terms of the joint the forward plan for this board. And just to a commitment that this isn't an additional plan. This is how we are looking to deliver elements of the strategies that are already in place, and what that might look like over the next 5 years. It is a plan that will be refreshed annually, so I think we need to bear that in mind when we're looking at this at the moment. There'll be elements in there that we are absolutely committing to. There'll be elements in there that we know we need to do more work on before we can be explicit as to what the change in the output might look like. So there'll be a combination of the two in that plan. And then finally, I just wanted to give a quick update on a more local focus. So within the broader integrated care system, there are the 3 constructs of place. So that is the more local focus within the broader ICS. And I do need to apologise for a rather unfortunate error in that the West Berkshire logo has unfortunately been missed off the slide when it was submitted, which is embarrassing given current company. But our place here that we refer to as Berkshire West does cover West Berkshire, Reading and Wokingham. Which makes us a slightly different place compared to others nationally, where they are generally coterminous with individual local authority boundaries. So I think that's a really, really important context in which we are going forward initially as a group of officers, and then we'll more widely engage with partners here at the Health and Wellbeing Board as how we best construct ourselves to make sure that we are absolutely identifying those opportunities where it makes sense for us all to come together, to work together and do something once across the 3 areas, noting that our NHS providers span the full geography as well, but also recognising that there's an awful lot that we wouldn't want to do any further away from our local authority footprints. So at the moment, some work's ongoing with Paul Coe, Maria and colleagues in the council around how do we want to structure and govern ourselves to make sure we've got that right focus on local ownership and delivery where it makes sense, and collaboration across the Berkshire West footprint where it makes sense, and collaboration across the broader BOB footprint where that makes sense. So that work's in progress at the moment, and I'll be able to bring a more detailed update on that to the next Health and Wellbeing Board if we can fit that onto the agenda either to discuss or to note. So I'll stop there and open if there's any questions. Thank you very much.
Thanks. If I may, a couple of comments. You and I have had discussions about the role of place and how place is organised. Clearly, you'll know one of my comments has been that we have member involvement at system level within the ICP. We clearly have member involvement in the Health and Wellbeing Board, therefore at the local authority level within Berkshire West. And I certainly agree that it is going to be easier for Buckinghamshire and Oxfordshire where their place is contiguous with their local authority. And we have started getting those conversations underway between, in my case, I sit with both roles, the executive member, the lead member for health and wellbeing, and the chairman of the board. It's not quite the same in Reading, and not quite the same it's the same Woking, but not quite the same in Reading. So getting those conversations going, whether it's as health and wellbeing boards or as lead members, to make sure that we are pulling ourselves together, because I think there is commonality of purpose, regardless of politics, regardless of political flavour, in our desire to get this right and move this forward. And therefore, there's a question as to member involvement, if any, at place. And we're having that conversation, which is good. So, members, are there any questions? I mean, clearly, those of you who are in the Health and Wellbeing Conference will have sort of heard this, and therefore will be, and I hope members of the Health and Wellbeing Board are pretty much up to speed with what's going on. I see no hands, so thank you, Sarah. We'll give you a break, we'll do something else, and then we'll come back to you for the item after this one. So we now move on, members, to the West Berkshire Vision. You have a draft revision in your pack. I'm going to ask Kathleen to speak to that in a moment, but I would just draw your attention myself to what I think are a couple of, I wouldn't say stark, possibly, but things to ponder upon, which are the graphics at the front and the back of the report, the where are we now and where we hope to be in 2036 graphics. And we all know this, but it doesn't harm saying yet again that the where we are now shows life expectancy of 84 for women and 80 for men. And we know that that differs across different bits of the patch. And therefore, one of the aims that we have as a board is to bring that back so that we improve the life expectancy of those who currently have a lesser life expectancy than others. But much more to the point, if you go to the back, high, healthy life expectancy is the aim, and that must be our aim. It's all very well living well into your 80s or 90s or even further, but you need to be healthy while that happens. Otherwise, firstly, you're unhappy, and secondly, you to be fundamentally, brutally frank, you cost money. You cost the council an awful lot of money. Let's remind ourselves that we spend over half of our budget on social care. And the other one, and this comes into that finance piece, is that where we are now is 4 working age people per retired person. And where we're going to is 3 working age people per retired person. And that to me is a stark number and leads into a question as to how we pay for all of this in the future. The other thing I was saying, I've spoken to Kathleen before this about this document. Some of the new commitments as labelled are actually removing or adjusting old commitments. So I'm going to suggest that we have a little flavour of the titling will be subtly different. So instead of new commitment, something like a edited commitment or a revised commitment, something like that, just to make it clear where it is a brand new commitment as opposed to something we're changing. And with all of that, over to Kathleen to talk to the report. Kathleen.
Thank you, Chairman. Better now. Indeed, this is the Vision 2036 refresh document. And we're asking here that the Health and Wellbeing Board adopts the refresh version of the document, and also the board notes the progress made towards the commitments in the vision document. In January 2019, Health and Wellbeing Board has agreed to adopt the vision, which is a 27 years lifespan of the aspirations, the 5 aspirations and commitments in the document. And because of the long-term nature of this document, it was important, and it is important from time to time to stop, reflect, and to see if the document is still relevant for West Berkshire and the context in West Berkshire. And the timing was about now because of the significant events that happened, COVID-19 pandemic, the declaration of the climate emergency, the conflict in Ukraine and the economic challenges and the displacement of people resulting from that and so on. So together with the organization in members of the Health and Wellbeing Board, we look at the review of the evidence-based, the social, economic, environmental indicators to see changes in trends and impacts, projections for long term, if they changed. We really wanted to involve the residents and to have their input, and we had a variety of age groups of residents involved and different backgrounds and different areas in the district, which I think along the lines of one of the commitments in the vision, actually, we tried more and harder to make sure that the residents have an input into this strategic documents. We also used a resident survey, which was representative for West Berkshire, so to make sure that we have a balanced view of the population living in West Berkshire, in addition to the seldom heard people being involved through the face-to-face qualitative engagement exercises. Members of the Health and Wellbeing Board, they have also been involved to look at achievements to date and to suggest any amendments to these aspirations and commitments. The result is, I'm pleased to say, that the vision, which is a long-term document that was supposed to withstand the shorter term impacts on different social, economic, environmental events, is still relevant. The majority of the commitments remain the same, slight changes in the wording. We will continue towards what we established 4 years ago. The aspirations, the 5 aspirations, they remain the same. And as a result, we put forward this updated version or refreshed version of the vision. Now, the vision is not a strategy. It does not have a strategy delivery plan as we are used to. Why? Because it is a document set to present the direction that we all, the council, partner organization, Health and Wellbeing Board, any other people living, working in West Berkshire, individuals or organized in any form, to take note of it and to do something towards these aspirations, because these are our collective aspirations, it's not one organization aspirations. However, we asked the question for members of the Health and Wellbeing Board to illustrate some progress made by the partner organizations. Because if you look, the Health and Wellbeing Board has a Health and Wellbeing strategy covering 10 years of the strategy, with a delivery plan, which is monitored and report. I think you have it on the agenda later today, reported regularly. The same, the council and other organizations, if you look at the council strategy that is championed by the leader of the council and the deputy leader and the executive, we have very strong, clear links between the council strategy, which is a 4 years plan with a society delivery plan, and the aspiration in the strategy, any other supporting strategies. They are all being detailed into delivery plans, and they are all being monitored. However, we presented some of the achievements, not all, I'm sure, in the document. As I mentioned, stronger links with the community, and COVID was a catalyst for that. The new university center at Newbury College to support the skills in the district. Crime prevention to maintain the low crime in the area. At points during the year, we achieved the 0 rough sleepers in the district, which is a great achievement there. Support for businesses, not only in crisis situation during COVID with grants and other recovery support, but with longer term investment in infrastructure developments, train station improvements, sustainable transport measures, upskilling and working with the workforce in the district to make sure that the businesses have the skills that they require locally. And a couple more initiatives to support better mental health, including to prevent suicide, to training and support for people to spot the signs and to intervene at the earliest opportunity. Establish the National Solution Delivery Partnership, again, to work at partnership level in the district to help tackling climate and environmental issues. We gave the opportunity to residents to invest in environmental projects through the UK's first community municipal investment bond to tackle to achieve carbon neutrality by 2030. I want to thank partner organizations to Health and Wellbeing Board for their contribution to refresh the strategy, to contribute with reporting achievements and providing feedback on the revised or continued commitments. And I invite any questions or comments before asking the board to adopt the refreshed documents. Thank you.
Thank you, Catalin. We'll go to members now. So, Councillor Doherty.
Thank you, Catalin, and thank you for a very good presentation this morning. So thank you, that's much appreciated. As somebody that was here in 2017 and knows the work that went into A, the original vision, and B, this updated vision, can I just thank you? Because I know you've put a huge amount of effort into this. And I think it's a really fair and accurate reflection of where we have come from. And I think it's also worth reflecting when we talk about where we've come from and all those challenges that we have. We've done that during a pandemic. So to actually have moved forward in this way is really quite remarkable in my view. So thanks to everybody involved with that. But what I would also say is we should never stand still. We should always have the aspirations and the ambition for the area to improve. So the way that you've laid out the new commitments within the report really help us to understand that. And I think that's a really good piece of work to lay them out in such a format. And I think, you know, there will always be more work to be done, but to have a vision of where we're heading is key. And I think this document gives us something, and it doesn't just give us something as a board because of the level of public consultation that has gone into this. I know you've used all the resident surveys and everything else. It isn't just this board's, it's actually the residents of West Berkshire. I think that's the #1 priority here, that we're listening to those residents and we're responding appropriately. So I just wanted to make those comments, but say that I'm more than happy to adopt this. I'm happy to propose it as leader of West Berkshire Council that we adopt this vision going forward.
Thank you. And Councillor Stewart.
Thank you. So actually, Catalin's picked up on a couple of points that I wanted to, so I won't stress them, but they're the key points that are very interesting to me, and it would be remiss if I didn't talk about adult social care, because you made that point very well, Chairman, at the beginning. Actually, it's so page 55 of the packs that we can see where we're talking about housing mix, and I think that is really interesting. It is in particular when we know that we have an ageing population, and actually we probably need to think more creatively about how we want to live as we get older. So that would include living a good life, living a healthy life. And in fact, in my own ward, I've got a development that is planned where it is and I think we probably need to come up with something other than retirement community, because not everybody that's getting older is going to be retired. The good news is next month I become old enough to go and live in one of these properties. So I can't wait for them to build it. But actually to have that community feeling, the support that is naturally there amongst the other residents, thinking about being self-sufficient in some ways, thinking about access to local amenities and transport, etc., I think is something that a lot of other countries certainly in Europe do, and I don't think we have perhaps got very far along that journey at the moment. So I'm really interested to see where that comes. And the other thing would be, so mental health and suicide prevention. And I just wanted to mention the fact that certainly in my role on the council and also in my role working for a charity in West Berkshire, I just want to reference the amazing voluntary sector that we have and the agencies that work across West Berkshire. And it's lovely to see Rachel here today from the Volunteer Centre, because again, that community feel we have across West Berkshire is absolutely essential, and we should never underestimate just how vital those voluntary sector agencies and partners are. And they very much help us to deliver these sorts of visions, and I just wanted to reference that really.
Thank you. Councillor Masters.
Thank you, Chairman. Joe, Councillor Stewart has said quite a bit about the housing, so I'd just like to say I'm in agreement. I think we do need to be a bit more innovative and a little bit more direct in our relationship with developers, certainly the larger developers, about what the mix is, because the figures we built to nearly 12,500 homes since 2020. But a very, very small portion of those have actually been affordable to buy for most households. We look at the average house price, it's £400,000. It's out of the reach of many in our community. So we do need to make sure that we reach the targets for social and affordable housing, and unfortunately, we haven't been doing that, and that does impact on the 4 working age people to each retired person, moving it down to 3, and further on it'll be even worse, because younger people will move away if they can't afford to live in and around Newbury and West Berkshire. So I know there's a lot of work gone into this, but maybe when we build a strategy out from this and the plan, we need to be a little bit more honest with ourselves that what the scale of the problem is, and how we're going to deliver that. So I think there's a lot to be grateful for where we live here in West Berkshire, and it's a great place, but there's also a lot of challenges that face certain members of the community, and not least in housing. Thank you.
Thank you. And Councillor Vickers.
Thank you, Chair. This is obviously quite a wide-ranging report, and I think it sort of covers most things, but probably it's just a case of more of what we have to do, probably more resources as well. And I think obviously going in other papers coming forward, we mentioned that health is part of everything we do, which is being increasingly obvious. And really, I mean, the basis of health, good health locally, is obviously for people to have a reasonably well-paid job, a roof over their heads, and then lots of things stem from there, really. And we've got quite a long way to go for that to really be the case for many people locally. And we are talking about health inequalities further on the agenda. I was going to say a bit more about housing. I see Matt Hensby from Sovereign has got his hand up, so hopefully he's going to be commenting on one of the issues I was going to raise, which is working with our partners in social housing and also the private landlords to make the most of what we've got and to help those that will never be able to afford their own homes to actually have a decent home with a reasonable rent. It's just so important, and a home that's well maintained, with a service that is looking after their needs. The other thing I was just going to mention is we've got crime prevention here, and that we do generally live in an area that is low in crime. But I'm just wondering, we've got some undercurrents possibly here that maybe we're not all aware of. And I wondered, we've got the police behind us here, about the situation with substance misuse, which is a growing problem, and possibly there is crime associated with that possibly we're not always aware of. We have very good partnership, the council, with the agencies that deal trying to tackle substance misuse. And I haven't seen a report to this committee for quite some time from these agencies. And I hope that's going to be something we'll see in the future. And maybe we need to know more about the work that's going on there.
Thank you. I mean, clearly, I would reflect on Kathleen's comment that this is a vision. It's not a strategic document. It is not the strategy or the delivery plan for that strategy. It is the vision. And in that light, and Matt and I are currently discussing housing provision in my ward, and I went public on conversations we've been having about a particular site yesterday, and that follows about getting on for a year of I wouldn't call it negotiation, of discussion, Matt. But over to you.
Thank you, Chair. And I think from a Sovereign perspective, we really welcome this report and this vision for West Berkshire. I really welcome the prominence of housing. I think it's such a crucial element of well-being and health outcomes. And I think the previous speaker mentioned that. So really welcome this. We look forward to working with our colleagues across West Berkshire, both statutory and voluntary, and in the private sector, around delivering better outcomes around housing. It's particularly encouraging that a number of the areas mentioned specifically under housing align clearly with our corporate plan around delivering innovative solutions for young people and older people. I share previous speakers around the term retirement. I also don't like the term older people either, so very happily take suggestions around that title. We look forward to developing increased number of affordable options for residents of West Berkshire, both social rented, shared ownership, and other products as they become available. But I think it's also crucial that the existing homes in which Sovereign own and other landlords own, there's a focus around improving and maintaining the stock there. I think that, as the previous speaker said, around private rented, and that being a really key area. There's work that always can be done to improve social housing, and registered providers will always stand ready to do that. But the focus also needs to be around the private rented stock as well, and the same level of focus around the quality and maintenance of those homes. And it's always good to work with the environmental health team at West Berks around that. As we move forward to develop the vision, develop the strategy and the plan, we look forward to working with yourselves, Kathleen and others, around developing options to meet these commitments.
And thank you. And I just to comment and picking up on Councillor Stewart's point, as someone who very recently became entitled to and indeed obtained a bus pass, I have to say that I pushed back on a report recently which described it had elderly open bracket 60 plus close bracket. That didn't go down well with me, I can assure you. Councillor Bay.
Thank you, Chairman. I want to echo the comments from the leader, congratulating and thanking Kathleen for the really hard work that's gone into this report, into this vision. It's welcome indeed. I particularly want to welcome the focus on improving attainment in STEAM subjects at our schools. We have great schools here in West Berkshire, and they contribute in great part to the vibrant economy and community that we enjoy here. And we have to make sure that we equip our young people for the future challenges that they'll face in education. And I really welcome the focus on this. Thank you.
Thanks. Yes, indeed. I saw STEAM and went, hang on a minute, I understand what STEM is. I better understand what STEAM is. Okay, members, I think that's all the contributions. I am going to slightly amend the proposal, which is to adopt the document, note progress towards aspirations and comments, but note the document with minor grammatical amendments that Kathleen and I might have a conversation about. So with that, does that find a proposer? Thank you, Councillor Dobbs. I'm happy to second from the chair, and I'm going to take an indicative. So everybody outside the room, please stick your Zoom hand up if you agree with this. Everyone in the room, stick your physical hand up if you agree with this. Right, we have an indication. You've seen that those outside the room have voted in favour. So those in the room, formal vote in favour or nay. Those in favour, those against, and abstentions. Thank you. That is adopted. Right, we now come back to the Sarah Webster show. And we have continuing healthcare and joint funding for health and social care. This won't require a vote. It is a report to note. Over to Sarah.
Thank you very much, Chair. And I think we might need a seconder to change the name of the meeting to the Sarah Webster Show, but I don't see any hands. So, first of all, just to remind members around continuing healthcare is ongoing care that the NHS funds due to a primary health need. So if an individual requires ongoing care and it's relating to a primary health need, then that is funded by the NHS. It's not diagnosis specific, so it very much does depend on the individual circumstances. And as with all of our health, it may vary at any time. So regular review and an ongoing assessment is built into the process. When Bob as an ICB was formed in July, it was a combination of 3 CCGs, and one area that we identified as something we wanted to look at was around our continuing healthcare arrangements. And so a transformation programme was born to look at this across the broader geographical footprint of Buckinghamshire, Oxfordshire and Berkshire West. In a nutshell, the work is looking to sort of review our service model for CHC with an aim for greater consistency across the three place areas, and review our arrangements for sort of procuring the care that we then are providing to make sure that we've got efficiencies of scale where that's appropriate, but also retaining local flexibility, noting the interdependencies with local authorities and the local care market. So that work is underway. It's detailed in the slides, so I won't go line by line, but just to note that the Transformation Board is attended by colleagues in this room. So Maria joins and all of our local authorities are represented. That is progressing. It's going slightly slower than the timeframes in this pack, largely because we appreciated we need to do more engagement on some of the proposals that we were talking about. So we did the right thing and made sure that we're continuing to discuss that with colleagues. I think what I'd like to focus on, though, is what that means for West Berkshire within the context of Berkshire West. So in addition to the kind of Bob-wide work, we've also got some very focused work happening here across the Berkshire West place on firstly sort of adopting the work coming out of the transformation piece, but also looking to try and remedy some of the issues that have been identified locally. Members will be aware of that there was a recent LGA review into continuing healthcare provision in Berkshire West, which identified a number of areas for improvement. And it's also, we are an outlier at the moment in terms of the level of CHC provided by population numbers. So whenever anyone's an outlier in anything, it is good practice to continue to review that, to make sure we understand the drivers behind it and whether we're an outlier for a reason or if there's action that needs to be taken to remedy anything. So the slides outline a number of the areas that we are looking at the moment. So one thing I'm delighted about is we've recently recruited a new head of continuing healthcare, which is a new post. So this is an individual who has worked in the NHS England Central CHC policy team, so is incredibly well versed on CHC. So she's coming in to provide a lot of support to Berkshire West as well. And alongside that, we're committing to a series of audits looking at how we are applying the CHC criteria. Historically, we have done this, and we are going to continue to do this to make sure that we are absolutely following national policy, as historic audits have suggested, but it's always good practice to continue those. And where, if there are any areas identified that we need to improve, we'll make those improvements. We are also making sure that we agree a clear disputes policy with across Berkshire West with colleagues in local authorities, because we want to make sure that if unfortunately a dispute arises between who should be funding the care, we've got a very clear policy to follow to make that as seamless as possible. And then slightly separately to continuing healthcare, but very much related, if somebody's not eligible for full NHS continuing healthcare, we can jointly fund packages of care with local authorities. And at the moment, we don't have a clear joint funding policy in Berkshire West. So whilst we are jointly funding some packages of care, we've identified that this can be clarified and further improved. So we've been working with colleagues here in West Berkshire and our other local authorities to agree a joint funding policy. That work is underway, and we're hoping to have that concluded within the next couple of months to then be able to add clarity to an area of work that we've been doing historically. And then we also want to, the LGA review clearly identifies that there's work to be done on relationships between NHS and local authority teams in this area, building mutual trust and mutual understanding. So as part of the rollout of the kind of the new operating model and the new policies, we want to do work across our teams to build those bridges because we are all here for the same purpose, to serve our residents. So we want to make sure that organisational boundaries don't affect what we're trying to do on a day-by-day basis. So that's a summary of the work. Just checking my notes. Yep, the key things I wanted to highlight, but please, if there are any questions, I'd invite them now.
Thank you. And thank you for that. And certainly, as undoubtedly Councillor Stewart will agree with me, because I had the adult social care portfolio and continuing healthcare was high on our agenda. And our perceived position within Berkshire West and where Berkshire West was in the table of local authorities receiving CHC funding was something that we were concerned about. And it's very pleasing to see Bob taking on board the question of getting consistency across the whole of the system as to how continuing healthcare is approached by the NHS. So very good. I see Maria nods because she's been involved in these conversations to a greater extent than any of us, I suspect. Members, any questions want to raise on that? It's a paper to note, so no vote. Thank you, Sarah. We move on. We now come to the Mental Health Action Group report on financial problems and mental health. There's been discussions about this report, as Adrian knows, and I'll comment in due course, but I'm going to invite Adrian to present, and then we'll come to what we're actually proposing out the back end of this. So over to Adrian.
Thank you, Chairman. My Wi-Fi here doesn't seem to be very good, so I'm relying on Gordon. I hope to show a presentation, if that's okay. My name is Adrian Barker. I'm the interim chair of the Mental Health Action Group. Next slide, please. So what I want to do this morning is look at the work we've been doing, where this work has come from, look at some of the underlying causes of the problems, both how financial problems affect mental health and vice versa, and other circumstances impact on it, and then to move towards what you can do about it. Next slide, please. And this one builds, so if you just want to keep a couple of the slides do that, I'm afraid. So the Mental Health Action Group is a subcommittee of this board, and it's been tasked with overseeing parts of the delivery of the health and wellbeing strategy. And this is looking at one particular part of that to do with financial problems, debt, and so on, and how that impacts on mental health. And this is particularly significant at the moment in the light of the cost of living crisis, but it's an ongoing issue. So this isn't just about the current situation, it's about sort of how these things work longer term. Just in terms of how we've gone about the work, we've been very fortunate in a steering group, multi-sectoral steering group. We've had a number of individual conversations with people and stakeholder groups, and I think we've worked with 19 voluntary sector and public sector organisations, and we're certainly very grateful for the time and commitment they've put into that. And that's been supplemented by looking at some of the research evidence, which very much backs up what we were hearing from people on the ground. Next slide, please. So how do financial problems affect mental health? Some of it, I think, is what you would expect. If you don't have enough money, if you're in debt, if you've got a sense of insecurity, then you're likely to experience stress, worry, and anxiety. But some of the effects are more indirect. Not having enough money can affect your physical health, which can affect your mental health. And living conditions, whether it's sort of having a cold house or not being able to get enough sleep, can also, in fact, impact on your mental health. And just to make the point, the childhood development point at the bottom there, these are long-term issues, and there's a fascinating bit of research about how stress in the womb can affect mental health into adulthood, which I found quite surprising. So next slide, please. But it also works the other way. If you have mental health problems, that can affect your ability to bring in money, to manage your finances. Stigma may be an issue. And even though I think that has improved over the last few years, it is still a problem. And there was a piece of research in 2015 for Public Health England, as it was then, that found that 35% of people wouldn't feel happy having someone with depression as a colleague, which I think is sort of quite worrying. And children, again, this long-term impact. If you are a child in a family with a lot of stress, it can impact on your education, which can affect your earning potential into adulthood. Next slide, please. So just to emphasize that these things work both ways. Financial problems affect mental health and vice versa. But it's not just that it starts in one place and ends up somewhere else. There's a kind of a ricocheting effect as one thing affects the other, and then that goes back and affects the first. Next slide, please. But there are also other factors, and again, this one builds Gordon, I'm afraid, so if you want to just click a couple of times. Thank you. So there is what we heard from a lot of the people we talked to was that people could be managing their finances, sometimes only just, but they were fine. And then something happens, whether it's a bereavement, redundancy, suddenly becoming a carer, that tips them over into not being able to manage. And there are other stresses that people experience: physical health, housing, crime, maternity, and so on. And for some people, these things get out of control, and particularly where there are addictions in terms of addictions to alcohol, drugs, gambling, or whatever, and people can hit rock bottom. And one of the organizations that we spoke to, who helped people who are homeless, said, we try and talk to people about budgeting, but they've got nothing to budget with, so it feels kind of insulting. So it just emphasizes that there's a whole range of factors going on here. Next slide, please. I won't spend a lot of time on this because I think this will be familiar to the board, because with many population health issues, the same groups come up again and again as being affected more than others. And this is Black and minority ethnic people, people with disabilities, families, lone parent households, and a number of other groups. Next slide, please. And this really just summarizes the previous point. So you have triggers which impact on finance, mental health, and yeah, that's the end of that one. And the other stresses impact on finance and mental health as well. And you've got a worse propensity for a worse outcome for certain groups. So that leads to a kind of a downward spiral that it can be quite difficult to get out of. Next slide, please. So then you come to the hard question of what do you do about it? So what we've got here is on the left-hand side, kind of summarize those problems. The yellow is financial problems, the red is the mental health, and the green are all those other factors which impact on people's mental health and their finances. In terms of the finances, I suppose essentially what you're trying to do is ensure people have as much money coming in as they can, reduce the costs, and improve their ability to manage their finances. In terms of sort of the other stresses from provider organisations, and by that we mean statutory bodies, DWP, the council, utilities, and so on. We heard that quite often the processes that people have to go through were increasing their stress, whether it's taking over an hour to get through on the phone or to negotiate their websites. So it may be that something can be done on that. Debt collection is potentially an issue. That wasn't that's sort of something we picked up from the research. The other thing about the stresses is a lot of those issues are already being dealt with by existing services. So there may be a limit as to what additionally can be done in terms of those. And then there are three things there which have an impact on finance, mental health, and the other stressors. And that's the voluntary sector support, which is very important. The idea of whole person cross-sector support. And that's something I think which has also come up in discussions about the cost of living hub, the ability to spend time with people and go through the whole range of problems and get to the bottom of it. It's sort of quite comforting to know that the ideas that were being put forward by other voluntary organisations were confirmed by that. And the third thing, which affects all of those issues, is information and advice. So next slide, please. That led us to try and turn that into some proposals. And I don't want to go through these in detail. I'll maybe say a word about each of them in a minute. But the first point to make is the work with stakeholders came to conclusions about the sorts of things that should be done. When we brought the report to the steering group, as all reports go to the steering group for this board, the point was made that it was quite vague, and we really the board would need to know who should be doing what about these things. So we tried to tighten those things up, sent it round to the steering group, but not with a lot of time for response, with only about a week to respond. It was then suggested it might be helpful to put those in the form of an action plan with action owners, timescales and outputs. So that was done, but again, at the very last minute. So very much, I was going to say anyway, and I think this is confirmed by what the chairman alluded to at the beginning, a sort of a health warning that really, I think we need to be quite flexible in looking at how these are implemented. Many of the proposals in any case are saying somebody should go away and have a look at this and consider it, so that they're not necessarily firm proposals, but the board may take a view on how they want to go through them. I'll just very quickly say just a word about each of the proposals. Next slide, please. And as you can see from this, there's 9 proposals, but each of them have elements. I won't go through the sub-elements, but just to say that the work with schools was something that a lot of people raised, felt it was important to start helping people with children with their financial management from an early age. Information and advice runs through almost everything. And it's about making sure that you can find direct help online, but that you're also signposted to where you want to be. But there is hard copy information as well if you need it. Digital inclusion was again something which came out very strongly from stakeholders. And this is about making sure people can have access to the online advice, but also in managing finances, being able to be online gives you a big benefit. Supporting and developing the community mental health transformation program. I talked about that whole person cross-sector approach, and that is actually being done. It's being rolled out across the country and reaching West Berkshire from April. It's called the Community Mental Health Transformation Program. That is particularly aimed at people with serious mental illness, but the same sorts of things which are proposed in that program could be applied more widely. So it suggested that that might be something worth putting in a bit of effort to and making that a success. Financial management, I think, speaks for itself. It's about trying to help people manage the money they have. Developing voluntary sector support. We heard lots of great things which are being done in the voluntary sector. And every time you go to a meeting, you hear about something new that you weren't aware of before. There are issues about how that is funded, and there's been a number of instances where there have been funds and they've not been fully taken up by the voluntary sector. So I think there are possibly issues about helping voluntary sector organisations apply for some of that funding. Employers' charters have an impact on physical health as well as mental health. So maybe relevant to other parts of the health and wellbeing strategy. So maybe something worth looking at. Improving providers' processes is what I was talking about before, just making things less stressful for people who are facing financial difficulties. And then the final thing there was just trying to find ways in which people's costs could be reduced. And one thought there was about investigating ways of providing cheaper, more sustainable energy or insulation for deprived areas and vulnerable families. So final slide, please, or second to final slide. So just a couple of points. This is just a starting point, and it doesn't cover everything. And as we say, I think the proposals might need a bit more work. But I think one of the interesting things was that some of these proposals may be relevant to other parts of the health and wellbeing strategy. And it might be worth thinking about how proposals like this could be used to streamline that delivery plan. And final slide. So happy to take any questions. Thank you.
And thank you. I'm going to come to Councillor Stewart first, because obviously she is the noted on the report as the report sponsor, and she's been quite involved in this. So, Councillor Stewart.
Thank you. And thank you, Adrian. That's a great set of slides, actually. I hope that anybody that is watching this has learned a lot from that, and will be able to refer to those on an ongoing basis, because I think that's really important. I need to start by saying thank you to Adrian. I think I've done this many times, but you know, you can never say thank you too many times. Adrian and also Rachel Johnson in our public health and wellbeing team, because they have been the real driving force behind this, the mental health action group in particular, getting all of the agencies and partners together. And as Adrian said, thank you to those stakeholders that took part. I think they're all, got a feeling they might be listed on page 90 if anybody wants to go and see them all. Certainly the groups that I've been involved in, it has been so good to have a group of people with expertise, with knowledge, and an external looking view. So this wasn't just about what our West Berkshire Council doing. It really was multi-party work and experience coming together. And I think some of what I like about what we've put together so far is that we haven't shied away from the sticky issues. So when you're looking at external and you're talking about major corporations, organizations, other sectors, utilities, I think is probably quite a good one, as Adrian mentioned. I've certainly had many battles with all sorts of different companies on phones, trying to sort through things. And from personal experience, when you are feeling stressed or depressed or just very anxious, then trying to battle through those systems can absolutely bring you even further down. How do we resolve that? Well, that's a really good question, and I don't know that we will ever resolve all of them. But I think that a lot of the external agency, the sort of larger corporations are realizing that actually mental health and money matters are absolutely tied together. I can think of one, I'm not going to advertise anybody, but one major high street bank who at the moment is advertising that they are working in schools to talk to children about money matters and how to become more financially aware at an early age. And I think that's absolutely essential. So there are some scary numbers in there. Communication, so many things in life are about communication. We have an estimate that £15 billion of benefits are unclaimed each year. Well, how on earth do we reach those people so that they actually get what they're entitled to, which may well help them? And if we've got a simple, easy claims process that allows them to get there. So again, all quite sticky, intricate, complex problems, but they need to be out there and we need to be trying to do whatever we can with them. So as Adrian mentioned and the chairman mentioned, this is at the moment for consideration. It's good that board members have seen it and been able to read it, and it will be good to hear sort of views and questions, but we do need to go away and think about those proposals and the actions and who would be the right people to work on those and put some deadlines in as well. And also I would suggest come back and report into the board again at a later stage. Thank you.
Thank you. And just to pick up something you just said, I reflect that I have a daughter. One of my best moments was when she came into the kitchen, probably about 12 or 13, and asked me what an annuity was. I thought, I I have succeeded. Councillor Vickers.
Thank you, Chair, and thank you, Adrian, for a very important report. I won't repeat. Councillor Stewart has said a couple of things I was going to say, but I'd just like to exaggerate the area of sharing information. I mean, I think quite often one agency will know something about a particular family or an individual that is crucial to possibly preventing them from getting into debt or from plummeting into mental health problems, but it's not always shared with another agency that's working with the family. So sharing information across agencies, whether it's a housing organisation, health, social care, can really, really help prevent catastrophic problems. And quite often people are still a bit precious about their information and they don't share. I remember a while ago, Citizens Advice used to have a specialist advisor for those with mental health issues, in the recognition probably that they did need more time. This is going back some way. And obviously that required extra funding. They lost that person some time ago. But I think, you know, time spent with people who are struggling to express themselves, to actually really share what's going on in their lives is really time well spent, because it can prevent all sorts of problems which then impact on things that the council sometimes has to pick up. The work in schools is particularly encouraging. Again, I can remember some time back thinking about housing issues, that there was a little booklet, I think it was produced by a charity, which basically was given to children, probably older children, before, you know, they're leaving school, explaining the housing market, social housing, how you went about getting a property, the importance of paying your rent, the importance of talking to somebody if you couldn't pay your bills. It was a dinky little booklet, and it was really, really useful. And I think things like that, we don't really think about young people needing that information, but they do need it before they get into those issues. So all those sort of initiatives, I think are really, really important. And I have concern about people with disability and their problems with accessing our services. They're very isolated. They can't use the usual avenues to get help sometimes. And I think we need to be always taking them into account, particularly the physical disabilities. And I'm very interested in this physical wellbeing hub that was mentioned. That's the first time I've heard anything like that. I hope it's going into the local plan or something like that, because I think that sounds excellent, because access to exercise, great if you can walk in the outdoors, but I'm not quite sure it would be involved in this physical wellbeing hub. But if it's a little bit of gym equipment or something, you know, people with little money don't have access to things like that, or access membership of expensive health clubs. So some sort of physical wellbeing club, which has probably quite a broader range than that, I think would be really, really important. And I look forward to hearing more about that. Thank you.
Well, on that point, I make two comments on what you just said. One is let's all be aware of GDPR when we talk about sharing data. So let's, you know, there are rules and regulations out there. Some for the very best of intentions mitigate against working in tandem on electronic data, certainly. And the other one is just to flag, and I would flag this, wouldn't I, as a walk leader, wellbeing walks, because after all, if we can get people out walking at least once a week, I can assure you our group, which is pretty sizable, if you ask some of them where they've been, they haven't got a clue because they were talking. Next, I have Councillor Masters.
Thank you, Chairman. Thank you, Adrian, and your team. Thank you, Joe, for sponsoring this report. I think I have, a couple of views that it's very much a cultural. We're at a certain point in in how we are as a society. There's a lot of pressure on people to, live certain lifestyles, if you like, and be part of the consumption and and especially there's a lot of pressure on that for young people, so they fit in and and everything else. So I think the broader question of how we aspire and live our lives is intrinsically linked to the financial pressures and our mental health and well-being. There's lots of great points in the report, and I commend Joe for bringing it, and Adrian and the team at the Mental Health Action Group for compiling it and putting a heck of a lot of work in. And I did have sight of it ahead of today's meeting and ahead of the agenda. And there's been, a number of fine tunings and on the delivery, and the presentation was fantastic. I think the Mental Health Action Group and through this board need to be quite ambitious and forceful is probably not the right word, but really push to get some of the points that they highlighted actioned with some credibility, rather than it be just an aspiration. So I trust that Councillor Stewart and Adrian, through the chairman of this board, will act on these recommendations and observations.
Thank you. Sean. Thank you, Chairman. First of all, can I just say I thought this was a very thought-provoking report, having been involved in the cost of living work certainly over the last few months, and as somebody with a public protection background, I recognise so much of what is in this report and fully endorse the recommendations. Just a couple of observations, really. One of the ones is around access to information, Adrian, that you talked about, and digital exclusion. And again, that's something that's very much come to the fore over the last few months in dealing with some of the cases that we have through the hub. So I think that's a really, really important area that we need to continue to look at, how we make available to that information to everybody. Also, I think going forward, April, I think this is something we can also take account of when we do the evaluation of both the winter outreach service and also the work of the hub. So we'll pick that up. I'll pick that up with April and the public health team about building that into the evaluation. And just one final observation, actually, that there are a group of people out there whose financial difficulties are caused by the fact that they themselves are victims of crime. And obviously, basically, particularly fraud and scams, and that quite often arises out of other vulnerabilities and everything else. So just really to say, I mean, as Al's in the room, I mean, we are working jointly with Thames Valley Police at the moment on an initiative to look at the issues basically around fraud and victims of fraud. And I think, again, it would be useful perhaps if we could develop something into these recommendations about basically how we also support those people with the mental health impacts basically of becoming a victim of fraud, because it can be significant losses and everything else that goes with that.
Thank you. Maria.
Thank you. As co-chair of the Locality Integration Board, I just wanted to say that there is quite a lot of reference to the board and the use of the Better Care Fund. Just to say that the Better Care Fund does have a set of national metrics we need to meet, but as we are just looking at our priorities for the next 2 years, I would absolutely support some of the proposals and work with Martin to look to see whether we can take some of those forward through the BCF.
Yeah, and as the individual actually signs the bit of paper, I will take an interest in that as well. And Matt.
Thank you, Chair. Once again, we really welcome this report. Really glad to have been involved in working with it, in developing the report, and look forward to continuing to do so. As an organisation, we not only see this as a live issue amongst our customers, but also the wider impacts on mental health amongst community safety and other matters as well. So anything we can do to support West Berks Council and other agencies, we welcome. The other area that I'd mention is the item that Sean, you mentioned around fraud. We'd be very happy to support that in any way we possibly can amongst our customers across West Berks area. And the last area I'd mention is there's really great work being carried out by the recovery the Recovery College in West Berkshire. Forgive me, that's not its correct name. But it would be good to see how that organisation is being utilised in the actions that come out from this report. I should declare an interest that my wife works for the Recovery College, so it's close to my heart, and she would rightly chastise me if I didn't mention it today.
Thank you all. I'll come back to you, Adrian, for a wrap up, if I may. I would just say that one of the things that came out of the Health and Wellbeing Conference, and we'll look at that in a moment, was this question of, in particular, Greenham Trust having funding available for certain things and people not coming, some of the charities not coming forward looking for that funding. So just to reflect on that. Adrian, if you'd like to just come back on anything you want to come back or not, as the case may be, and then I'll go to what I'm proposing to deal with the report. Thank you.
Thanks. No further comments. Just welcome those very useful practical suggestions that were being made. Thanks.
So members, what I'm going to propose is that we note the report, and I endorse everything that's been said about the amount of work that's gone into this beast, and that, as Adrian reflected, it really didn't come through. That we have the steering group, which sits as a sort of a filter of reports coming through to make sure they are in a state where we can put something to the vote, if that is what's required. I don't think we're quite in that position with what we're looking at. I think there's a bit of more work done to come to refine the proposals in conversation with teams within the council and teams elsewhere. So I will put that back to Adrian, Joe Stewart as the report sponsor, and I guess April and the team within public health and anyone else who wants to get involved in order to bring this into a set of refined proposals which officers and the wider community is happy with, comes through the steering group, and then we bring back. We won't need to go back through the report because we've got the report, but we can finalise the recommendations. So I'm going to take an indicative vote and then a formal vote on what I've just proposed. If it finds a seconder, Councillor Stewart, thank you. So everybody in the room and out of the room, raise hands or stick your virtual hand up. Thank you. Now, taking that on board, those in the room say yay. Anyone against? Any abstentions? Thank you, members. That is agreed. Right, we now move on to the Health and Wellbeing Conference. You have a report in your pack as to what went on. I will present it as the chairman of the conference. There's a number of things that officers have reflected upon and indeed reflected upon with the benefit of the forms that those who attended filled in to say what they thought of the afternoon. And I can assure officers that the ones I would pick out are the question of lead time into the conference, about the venue, and the question of picking up comments. Some people in the room couldn't properly hear what was going on because of the way in which the mics and the speakers are set up, and the question of workshops. What we're going to do, I've asked for a meeting to be called of officers and myself and possibly the leader in order to look at the joint question of the Health and Wellbeing Conference and the District Parish Conference, which this year we followed on from the Health and Wellbeing Conference. Question of venue, question of setup, whether it's held here, might be held in Shore House. There's a whole load of conversation that needs to go on about lead times. But at the moment, I think the thought process is that we we split the two apart, that we have, the aim would be to have the District Parish Conference, I think, in a this of course is an election year and that has affected timetables of all sorts of things. But in a non-election year, to move the District Parish Conference, the first one, forward so it comes after the budget, so that the budget can be reported on, because that's actually quite an important piece. And then another one in October. And so as the Health and Wellbeing Conference are concerned, we'll discuss when we're going to hold it, but sometime early-ish in the year, but with plenty of lead time, so that everyone has plenty of time to decide what we're going to discuss, how we're going to discuss it, and who's going to present. So I wasn't going to go to that, but Councillor Vickers, you wanted to say something.
On 4.4, is that, it says Westminster drug project? Should that be West Berkshire? Is that Westminster?
No, the WDP, which is how it's titled, is titled WDP.
Oh.
Westminster Drug Project is the provider for our drug
Okay.
our work in the drug field.
Took over from Swan as well.
Indeed. Drug misuse. Yeah, the leader has asked me to make it clear that we don't endorse drug misuse. It's our work in drug misuse area,
Okay.
and indeed, and I had this debate about alcohol and tobacco in relation to health, and the question is as to that we have illegal drugs, and then we have legal drugs, and the issue as to those the effect of those on health. So yeah, but the Westminster Drug Project is the body that operates that.
Thanks for that clarification. I thought the stalls, and I did talk to, I assume, the representative of the Westminster Drug Project. Interesting stall, interesting young man, and I think it's always. I think this conference is very important. It's very good to engage with the public. I mean, we were told prior to it that we couldn't attend because in person, because initially the seats were all taken, but there were quite a lot of vacant seats when I came. So I don't know whether people pulled out or, I mean, Gordon very kindly told me that, there were vacant seats, so I was able to come in person. But there might have been other people who might have liked to attend it in person, because it's much better than being on Zoom if you can attend. So yes, valuable conference. I think more ability to discuss things with, as you said, workshops with other members of there is always good, exchanging views. And although I think the Bob presentation, because it's such a complicated subject, I'm afraid some people were none the wiser after the presentation. So I don't know how one presents that. I mean, I still look at all these, I see, yes, I see. And I think, now, do I know? Yes, I think that's it. And then I'll have another look again. So it's such a complicated structure. I mean, how one simplifies that to members of the public, I just think it's I don't know what we do there really, because it's such a complicated thing to get over to the public. But yes, a valuable conference. Certainly don't have the two in the one day. I met somebody who was basically spending the day in Newbury so he could come to the evening thing, which he probably would have preferred not to do, but didn't want to go backwards and forwards. So yes, thank you to those that arranged it.
Yeah, I think I would comment as follows. Firstly, on the subject of breakouts, I think there's a debate there. Breakouts can work, but then if you're in one room, you're not in the other one, and you might have something to contribute to both. So discussion is certainly useful, and it does take it can take an amount of time to set up, so get everyone into the room, and then whether it's virtual or physical, and then everyone back out of the room, back into the main meeting. So there are two schools of thought there, and we will debate that. On Zoom and physical attendance, my recollection is that we anticipated, we had effectively, I know it was free, but we had sold seats for 70 to come physically to the room. Now, if they don't turn up, what do you do? But we had anticipated, I think we had actually 65, I think, from memory, something like that number in the room in any event, and about 30 or 35 on Zoom. And I would say that and I would say this, wouldn't I, because I live in the bottom corner of West Berkshire, it is often convenient for me and for my compatriots to attend a meeting virtually rather than having to come into Newbury for an hour's meeting and then go home again. So there are two schools of thought, and I think getting the right combination between physical attendance, and I absolutely agree with you, that physical attendance is very useful, and that was the point I made to members of the board, and why I'm so pleased to see so many people physically attend this meeting today. But nevertheless, given the shape of the district and the size of the district, having that capacity to engage people virtually is also actually quite important. But we will debate, and we will come back with an all singing, all dancing health and wellbeing conference in the near, sometime in 2024, you lucky people. Members, we now move, that was just to note, so I'm not going to take about it. It is simply, the report is there to note. And thank you for the comments. April, I apologise, I'm not looking at my screen. April, do comment.
Okay, it was just in response to Martha saying it's quite difficult to understand all the different bits of the system. There are actually some quite useful little short videos that I've looked at quite a few times, and so they are quite helpful. Sarah's probably aware of those, so perhaps we could share those with members of the board to have a look at, see if that helps.
Thank you. Take that on board. I'll let you liaise with Gordon as to where to find those so that that can be circulated. And I would say on the subject of the comms piece from the ICB and ICP that I did have some figures. We had the first public meeting of the ICP not that long ago in Oxford, and I had some feedback from one of my fellow governors on Berkshire healthcare saying that he'd wanted to access the meeting and the link didn't work and this didn't work and that didn't work. So I fed all of that back because obviously public engagement if you understand the system, once you understand it, public engagement in the system is quite important. So that those comments have gone back into the ICB for reflection. Thank you. Okay, April, we now keep you in the room and move to you to talk to the strategy delivery plan and where we are.
Thank you. So this is the third quarterly report of the progress on the delivery of the actions within the health and wellbeing strategy delivery plan. And I'm sure you can see by looking at the delivery plan that some excellent progress has been made on many of the actions within the plan. However, following feedback from action owners and following the discussion at the Health and Wellbeing Steering Group and with some of the subgroups, I would like to propose that the delivery plan is refreshed just to make sure that the actions are relevant and reflect current situation and current priorities, and especially in relation to the great presentation that Adrian did today. Is we might need to consider some of that as part of the refresh of the plan. So the intention is to convene a small task group to review the actions and ensure that all the actions are allocated to a subgroup as well underneath the Health and Wellbeing Board, because we think that would be useful. Some of them don't seem to fit neatly at the moment with some of the subgroups, so we would like to review that. And then to bring that sort of new refreshed delivery plan to the next Health and Wellbeing Board or when the Q4 report is due, and to make sure that that new delivery plan is uploaded onto the new in-phase council management system, which we are hoping should be ready by July.
Thank you. And I reflect, and certainly there was reflection at steering group about some of this, the RAG rating within the report and just cleaning that process up. And also in due course, I'm looking at Kathleen now, to move this into Kathleen's new all singing, all dancing project management and program management system, which will hopefully make it more easily assimilable for us, and those contributing to it will find it easier to contribute where they are with their actions, if it's a particular group or whatever. So thank you for that. Now, one of the it's not in the agenda, but it's in my chairman's briefing, so I just want to clarify this. One of the things we're being asked to do is convene a small task group. Okay, who's going to be on this small task group, and is it going to be really small, April?
So probably myself, Gordon, some of the chairs from the subgroups, Sarah as well, if she's keen, keen to join. So just a few sort of key officers, so that we can just look at the plan, make sure that it really is current and sort of fit for purpose, really. So yes, just a small number of officers.
Okay, so I'm going to, members, I'm going to give you the proposal in its bits. Firstly, to receive the progress report and note the changes. Secondly, to agree that the delivery plan is refreshed to ensure actions reflect current and relevant priorities. Thirdly, to convene this task group, and I'm going to propose that April leads that and organises that, and I leave it to her to work out who's going to be on it. And finally, to note that the program management system currently in testing and that the delivery plan will be added to that system following that testing phase, which is, and I hadn't even read that before I said that to you, Kathleen. So, Members, indicative vote as to whether those are to be agreed. If I propose, April, I'm going to ask you to second. Go on then. Members physically and in the and virtually agreed. Okay, so now members in the room, formal vote. All those in favour? Anyone against and any abstentions? Thank you. That is carried. Okay, so now we move to the perhaps easier bit of the meeting where we have items that are not for discussion. They are simply reports for you to look at and understand. I do apologise, Councillor Vickers. You had your hand up. I apologise, Councillor Vickers.
Thank you. I mean, this is a long report, so obviously we could spend the whole of the meeting talking about this. It's quite difficult to read, but I did sort of try and read most of it. Just a couple of comments. There's a bit about health visiting and working with families in the early years, 2.27. And I thought that looked good, what was being proposed. But I just wondered about the resources. Do we have enough health visitors? Are the numbers still sufficient to deliver what's outlined there? Because it looks like good work, working with parents. There was also 1.6, there was a mention of working with people with sensory empowerment, communicating with them. And I quite recently came across a lady who is virtually blind and also has other disabilities. And she said she was really struggling to communicate with the council. I think there is a facility where you can communicate with people with severe sight impairment through emails. I assume it probably, sort of makes the type bigger or something. I'm not quite sure what the technology is. She did tell me, but I haven't got a note. But she said in other agencies have this technology, but she doesn't think the council is using it. So it would improve her communication. So that's just a little point about working with those with sight impairment. And although we have 0 rough sleepers, virtually 0 rough sleepers, but those, and I don't know whether you've got anybody here to comment on this, I think we do know that there's still a lot of people in the area who sleep in their cars, etc. So it's not absolutely 0. And there's been quite a lot of comments about there needing to be a place for those with complex needs who are needing to be accommodated in Two Saints, and those with less complex needs, because some people are still avoiding going to Two Saints because of difficult clients that are housed there. And I think that's just in relation, I think it was 2.24 where we talk about rough sleepers. And I don't know whether there's any conversation that is going on anywhere there about a different way of dealing with that vulnerable section of the population.
April, can I invite you to comment to the extent you are able on what Councillor Vickers just said?
Yeah, so in relation to the health visitors, we are in quite a good position in West Berkshire in terms of our complement of health visitors. I think there was quite a few actions there around children and young people in the plan that do need looking at and giving a little bit more detail around that. So I think that feeds into that, the conversation in terms of we need to make sure that we can give good feedback on all of these actions to make sure that they are relevant. With regard to some of the other things you raised, I can't give detailed answers to those, but I will take those away, Martha, and make sure that as part of this refresh of the plan that we are looking at those things, and where we've got actions, that there is proper commentary and feedback against those, and to make sure that it's clear for everyone. And I take on board your point about the plan. It is big. We've got an awful lot of actions there, and that's one of the things, the reasons that we want to refresh it, to make sure that we, can be categorically sure we need to have all of that in there, and that it can be in a really good position to be able to be read and to be able to follow it.
Thank you both. Yeah, I think I would reflect that any action plan on anything is going to be large. But if you're going to identify who's going to do something, it comes down to some fairly finite, almost single rows in a lot of cases, and therefore it is necessary to really break it down to who's going to do what and what's the test for success. Members, as I say, I apologise. Councillor Doherty, I do apologise.
Thanks. I didn't know we were going to go through the plan, but while we are, I just wanted to highlight young carers. And we were doing some really good positive work here, and yet all of it's just about gone red, and we seem to be changed provider. And I just wonder what's happening for our young carers, because when you look on here at 2.3, and then again further down it comes up as well, we were doing some really positive stuff, and it doesn't feel like that's moving ahead. The times are out of date, the referrals are out of date, there's not enough information on there, and that really concerns me, April.
Just to say that the Children's Delivery Group have asked, so Neris did look at the all the actions there around the children and young people, but the Children's Delivery Group have asked if they can look at their actions as part of this refresh, and then make sure that we are updating appropriately. But I will find out for you exactly what's happening in relation to those indicators.
Thanks. Can I just highlight the Children's Delivery Group? This has been a consistent theme over the years. I'm not, having a go at you, April, but the Children's Delivery Group seems to take a secondary back slot to a lot of the other delivery groups, and even the reports we have coming through. So I'd really like to see a focus on the children's piece going forward, Chairman.
Noted. I think we note that. Indeed, I've seen some stuff that's come through about revision in that area. And indeed, to a certain extent, the difficulty with these spreadsheet delivery plans is making sure they are updated accurately and timiously, which is why when we get into the new software, as I understand the intention is that that reactive piece will be much closer to time, because whoever has ownership of whatever it might be has direct access to update their row, line, whatever it is of the plan, so that the thing is much more up to date, and we really do get a handle on what is going on the ground. But leaders' points are entirely taken, and you've heard them.
Can I just say as well, just in response to that Dave Rape is the new chair of the group, and he is absolutely on board with this, and he really wants to take the work forward. So just for some reassurance.
And he and I have just agreed revised terms of reference. So yeah, it's all there. Okay, members. So as I say, items 15, 16 and 17 are for everyone to note, read, and if there is anything in any of those reports that you think requires further discussion, please pick it up with Gordon and we will bring it back. But I'm hoping that clearly these are effectively, so far as the Safeguarding Adults Board and the Safeguarding Children's Partnership are concerned, these are reports they're required to put to us, and we're required to receive them, but in a sense it's their report, and therefore this is to some extent not an opportunity to question them, because they're not in the room to be questioned. You need to go to the board. Councillor Bowick.
Thank you, Chairman. Just, I guess, on a procedural point, the children's safeguarding paper that was published in September last year. It just seems to be an awful long time for it to come to this board for consideration.
Well, as I say, whether it is coming here for consideration or whether it is a statutory obligation on that body to deliver it to the board is a moot point. I guess the question as to why a particular board publishes a report in September and it doesn't land on the agenda for the Health and Wellbeing Board until February is clearly a question, but can I leave that to officers to look into, because obviously I take that entirely on board, but I don't know the answer to the question, and we need to take it away.
Thank you.
Thank you. So members, I am going to move us on to members' questions. I don't believe there have been any, Gordon.
No members' questions received.
And now I take you to the final page of your pack, which is the Health and Wellbeing Forward Plan, the board's forward plan. Does anyone have anything they want to pick up? That obviously, again, this has been looked at by steering group, and it is our, as it were, programme of work. Maria.
Just to say, I think the Better Care Fund for the next 2 years will need to be on the forward plan.
We hear that. Gordon makes a note, which is always helpful. Do you want to pick?
Is that coming to the July meeting, Maria?
We're waiting on the planning guidance, which is supposed to be due out mid-March, so.
Well, I leave, Maria, I leave
yeah.
you and Gordon to liaise as to where this will appear on the forward plan. Anything else? Sean?
Yes, Chairman, I just wondered whether it may be worth bringing back the evaluations that I mentioned earlier on that are being carried out by ourselves in public health. I mean, probably about July, I would imagine, would be the right meeting for that, April.
April's nodding, which is always helpful. Yeah, okay. Again, Gordon makes a note. Excellent. Anything else?
I mentioned earlier about hearing about from substance misuse services. Is there any way we can, or is that something for the future? Because we haven't had a report back from them for a while, and I think their work is.
Let's take that back through steering group, which is obviously the starter point, and then taking that on board, and we can probably bring something forward to the board. Because I mean, the thing is that the sub bodies will do, generally speaking, either a verbal or a written note as to what's been going on in that sub body in between steering group meetings. Whether or not we then bring that, if we started bringing those all forward to the board, we've already got a big agenda. It would get very clunky, which is why they tend to be reviewed in the steering group. But certainly, if needed, we can then bring those forward. If members have an interest in a particular item and think it hasn't been discussed for a reasonable amount of time, absolutely, we'll bring those forward. Noted. Okay. Members, this is the last meeting of the Health and Wellbeing Board in this municipal period. The municipal year, sorry, no, it isn't. It's the penultimate meeting, because what we've done is we've had to bring forward the next meeting in order to get ourselves within time. Because obviously we have elections coming up in May. So the next meeting will be on the 20th of April. And then we will look at, the new council will look at its timetable for the next 4 years after the elections in May. Maria, is that a legacy hand? I'm guessing it is. Thank you. So members, I call the meeting to close. I thank you for your physical and virtual attendance and wish you well for the rest of the day.